GI doctors earn more money doing biopsy during colonoscopy. So if this doctor would like to earn 20, 30, 40, 50% more for a colonoscopy, he will go and make a biopsy. There is so many things that he will not understand what is it. For example, hyperplastic polyps are very similar in morphology to the adenoma, and if he would like to earn some more money, he will go for biopsy. And most cases of biopsy of the colon is very thin wall. He will perforate it. And if you look to cases of colonoscopy where the doctor made a biopsy, you will find that the rate of complication and the side effects are huge, starting from perforation, peritonitis, and also the hemorrhage and rectal bleeding and the abdominal pain. I wonder if this doctor doesn't know the difference between hyperplastic and adenomatous, and hyperplastic are normally polyps in the large intestine, and if this polyps does not secrete ocular blood or positive for DNA immunoglobulin, then why we have to biopsy it? And as I said, even if this is a very, very slow growing cancer, like sometimes cancer of the prostate, very slow growing cancer, take 10 years, 15 years, 20 years, why I go and disturb these lesions and they cut it and they mix the cancer cells with the blood cells in the body so they can go and metastasize, spread in the lungs, kidneys, and everywhere. This is ill-fated techniques from GI doctors who wants to earn more money doing colonoscopy to people that do not require colonoscopy. They are not at high. This disease is genetic, mostly runs in the family. So a family history, besides some lab tests, will separate those 95% of the people that do not require colonoscopy, but they go and do it because of the fear effect. When you scare people from a disease and tell them that every man and woman over the age of 50 should do colonoscopy, this in indirect way you tell them that this disease infects every human and man and woman on the earth. And this is not the correct looking to this disease. So somebody have to revise, somebody have to stop this practice before killing all our senior people. It ran from 14 million people did colonoscopy this year, for 2,000 people, billions of dollars, for no reason except to get rich quick. So, and if you go and complain, they tell you, you have to thank God that we did the colonoscopy for you, like the California Board of Examiners. They said, well, rectal bleeding and abdominal pains are not a side effect of colonoscopy. This man went 20 times to the emergency room, and he's suffering, he's dying slowly after colonoscopy. Somebody have to stop this practice. Thank you, and I will see you in next video. This is Dr. Siam, and see you again.